People cause accidents. To be more exact, people not paying attention or doing something that they shouldn't be doing causes accidents. To put in another way, accidents result from varying degrees of carelessness, sloppiness, negligence, inattention, laziness, and ignorance. Accidents also happen where two things are found: unsafe acts and unsafe conditions. For example, in this situation, in this scenario, there is an employee who is in a hurry to go downstairs because she has turned over the documents to her boss. Her boss is calling her that those documents are needed. As she hurried down the stairs, she did not realize that she would meet someone on the stairs, and the worst thing is, she even bumped into him, which causes him to fall to the floor and broke his ankle.
Treatment for sprain and strain is we use the acronym RISE. You rest the injured limb, you put ice on it, you put compression bandage on it, and you elevate it. In here, I am going to expose the injured limb and I'm going to use my knee to elevate the limb. Next thing is to put some ice on it. Never put the ice directly on skin. Place it in the injured limb and leave in place for 10 minutes. Next, I'm going to use a compression bandage to put compression or apply pressure in the injury. So start above joint. Secure your bandage. Come down and make a figure of 8 around the injury. Continue doing until the whole bandage is used. And lastly, I'm going to use 2 pieces of tape to secure the bandage in place. Why is first aid important? First aid knowledge is invaluable for both you as an individual and for your community. It enables you to assist persons who become injured in the event of an accident or emergency situation until help arrives. First aid skills can be applied in the home, the workplace, or in public locations. Therefore, the more first aid certified people there are in a community, the safer that community becomes.
one thing to remember, you can make the same mistakes many times without knowing anything but happening. Some people always did it this way and nothing really happened until today. Over time, you come to believe that some unsafe conditions or acts are okay because you have no evidence to contrary. Whatever we do, our job is to identify many errors as we can and correct them through the education process. Changes with equipment modification or any other way needed ensure that we all go home safe at the end of each day. First-degree burns are very common, unlike second or third-degree burn. First-degree burns only involve the top layer of the skin. People often get these burns after accidentally touching a hot curling iron, hair straightener, or stove. Sunburn can also be a first-degree burn. If you have a first-degree burn, your skin may be red, painful, and have mild swelling. Only minor burns should be treated at home. If you experience more severe symptoms or have a burn that is very large and painful, call 911 or go to emergency room immediately. To treat a first-degree minor burn, follow these tips from dermatologists. Immerse the burn in a cool tap water or apply wet compresses. Do this for about 10 minutes or until the pain subsides. Cover the burn with a non-stick sterile bandage. Do not apply ointments, toothpaste, or butter to the burn as these may cause an infection. If blisters form, let them heal on their own while keeping the area covered. Do not pop the blisters. Consider taking over-the-counter pain medication. Acetaminophen or ibuprofen can help relieve the pain and reduce inflammation.
First-degree burns usually heal on their own without treatment from a doctor. However, if your first-degree burn is very large, if the victim is an infant or an elderly person, or if you think your burn is more severe, seek immediate medical care.